Hello everyone, my name is Elizabeth Leroux. I am a neurologist in Calgary, and I'm very proud and honored to record this first video to talk to you about Migraine Canada, a newly registered not-for-profit to help people with migraine and other types of headaches. Migraine is the third most common problem in the whole world, according to the World Health Organization. So it touches probably around 15% of the world's population, more women than men. That means 5.5 million Canadians, and if we only think about chronic migraine, which is the most severe form, is probably around 350,000 Canadians suffering from it. To take care of all those people, do we have enough headache clinics and enough headache specialists? It's very unlikely. So that leads to underdiagnosis and undertreatment for people with migraine and headaches. Those people often are victims of stigma and blame, and they can go through a lot of isolation and suffering that could be broken and improved if we had more resources and better access to care. So the goals of Migraine Canada are multiple. We want to work on education and awareness. And education means, of course, giving reliable scientific information on migraine to people who suffer from it. But it also means, as healthcare providers and Migraine Canada, listening to people with migraine, hearing what they need and what they want. This is a two-sided communication, and only with trust will we build a significant progress. When you suffer from migraine, you also need support. When you go through a difficult phase, well, sometimes your family or friends are not the best people, and what you really need is someone who truly understands you and has gone through the same difficulties. Establishing networks for migraine people is probably a good way to help them go through their most difficult moments when they need it. Advocacy is also a pillar for Migraine Canada. And what does that mean? Well, it can mean, for example, advocating for drug coverage for migraine treatments and medications. It could mean advocating for better training of physicians so they can take care of migraine and headache better. It could mean talking to employers in the workplace, explaining to them why it's important to set up accommodations for migraine sufferers. And of course, we need more public programs and government initiatives for migraine and headaches. And without research, well, we wouldn't have new treatments. We need to fund research so science can progress and offer new therapies and better understanding of migraine condition and headache conditions. So I've been saying a lot of migraine and headaches. Why? Because migraine is the most common headache, but there are many others in need. And that includes things like cluster headache, trigeminal neuralgia, and post-traumatic headache. So at the end of the day, we have plenty of ideas. We could do a lot. We could organize talks and events to inform people. We could create networks of support like Facebook groups, migraine cafes. We could probably establish a list of resources of headache clinics and headache specialists across Canada so people can find help. And we can, of course, improve our website that is in need of an update, and we will need your insights to do that. So what can you do? Well, you can stay tuned. First, you can be a little bit patient because we're just starting. At present time, we're working on our structure and we're trying to establish a solid organization that can help you in the future. If you want to volunteer or if you have questions, well, do not hesitate to email us at migrainecanada@gmail.com. We need people to do all kinds of things like event planning, social media management, communication, fundraising. Any idea is welcome. So thank you for listening. Stay tuned, and I will see you very soon for more information about migraine and headache. Have a great day.